Hi everyone, welcome back to my YouTube channel. This is Jane and this is the Overseas Nursing Bands. Yes, so this channel is all about empowering nurses, foreign trained nurses who are on their journey to becoming UK registered nurses, and we just put out information there to help you with your OSCE registration processes and all of those good things in between, to be honest, really. So welcome. Thank you to our old subscribers that are coming back, and thank you to the new ones. You're welcome. Come and enjoy the train. So today, before we continue, I'm just going to say to you, how are you? Are you all right? Doing well? You doing well? You all right? It's important to take care of yourself, even though we get consumed with all the activities, trying to register, trying to make it, trying to get the bag. Yeah, take care of yourself. Anyway, today I'm just going to do a quick video. So I'll be looking down because I've written down what I'm going to say. It's just about how to get the kind of questions you will expect for your interview. So if you come into an agency or directly to an NHS trust, and before you through the process of your registration, getting all of those done, you have to have an interview to be able to get your COS, obviously, and then to come down to the UK to do your OSCE. So some of the questions that you're likely going to be asked are as follows. Wait for it. What do we say? Is it drum roll? Well, no drum roll here. Anyway, the questions is going to say, obviously, most obvious questions. Tell me about yourself. When they say tell me about yourself, they're not saying to tell me your name is Lagbaja Ajaniki Sororo. I'm 20 years old. No. Tell me about yourself. What is interest? So this is the opportunity to actually sell yourself. Oh, I trained in so place. I've done, you just bring us some of those soft skills that you have had. Soft skill or whatever skill, to be honest, really. And that questions that you asked said you mistakenly, because obviously you're going to have clinical questions and general questions for you. So tell me about yourself. Tell me, you mistakenly gave a patient a wrong medication. What would you do? This is a very, very, you're not going to try and hide it, or I don't want them to know that I gave wrong medication. You're going to say as a professional what you're going to do. There are procedures and policies for where you're working on what to do. It could be you just observe the patient, depending on what medication you have given. But first of all, you just have to say, as a medical professional, my aim is to give my service in the best way possible, safest way possible. But because we're human, mistake wants to happen. Then this is what I'll do in their situation. Okay, inform the manager or your supervisor, observe the patient, make sure they are fine, follow the protocol, the procedure. It could be calling the pharmacy, it could be depending on what's the procedure, but you know that you just have to. One thing I generally advise is keep talking. Don't answer one question and keep quiet and interview. Keep talking until they shut you up. So just keep talking, keep going. All right. And said, how can you deliver a complete care and give an example of when you did that? How can you, if you're a nurse and you've been working for at least 1 year, or even you just qualified but you went for placements, so how do you give complete care? You choose a case scenario where you admitted, for example, maybe you were working at the outpatient OPD and you gave a complete care. You admitted, you clocked in a patient, all the procedures you went into, all that you did for the patient. And so you could say, oh, when I was a student, I was on placement, or when I worked in the med-surg ward, or when I worked in ICU, I had the patient come in, and then you go through the procedure of basically what you did for the patient on the day, to be honest, a holistic care. Okay, so you saw two of your staff members quarreling inside the ward. What would you do? That is a tricky question. If you had seen two of your staff members quarreling inside the ward, what would you do? Of course, you're not going to be on one or shout at the other or anything like that. Tell your supervisor, or you just tell them, can they please go somewhere and sort themselves out, and then inform your supervisor if need be, depending. Okay. Have you been involved in an audit? Tell me about it. I know it looks like, oh my god, audit, but I mean, if you're, for example, you're taking over CD medications, that's, you're doing audits, you're checking, you're auditing it, really, has it been given, or so that is the simplest thing like that. Or your medication chart, you're going through it, you're on charge. Okay, has it been signed, has it been dated? That's an audit that you're doing. Or what could you say? So it's not like, oh, you're auditing a whole, it could be your just simple things like that. So have that at the back of your mind so that it doesn't throw you off like, oh my god, audit, I don't work in Ernst & Young or KPMG. No, that's just it. How would you observe a deteriorating patient, and what would you do? In this case, I would say it depends on what the patient, what's the condition of, is it a palliative, is it an end of life, is it someone that is just a critical condition? What is it that I'm dealing with? So you have to think fast in your head and then make a scenario quickly and tell them what you would do to a deteriorating patient. So if you decide to choose a patient that was bleeding and you know what to do, how to stop the bleeding, and if it's somebody that is asthmatic, they had an asthmatic attack, if it's someone that is actually end of life and is dying and actively dying, I like the word, one of my colleagues used that word, actively dying, since I've been obsessed with it. Is actively dying, and she said somebody was actively dying that during a handover, and before you could say Jack Robinson, the person died. So so if a patient that is actively dying, what, obviously to make them comfortable, make sure they are not in pain, you know, all the comfort they need to die a pain-free death, if that's what you want to. If it's, you know, somebody you plan to resuscitate, if it's, it depends. So you just choose quick, choose a scenario and talk. Be confident. Speak. Don't even remove too much and pauses. Try and flow, you know. Flow like a river. Okay, I don't know what I'm singing, but you know. She said, how do you manage stress at home and at work? I think one of the interviews I had, this was a question I was asked: how do you manage stress at home and at work? And what I just said, I'm obviously a very spiritual person. I'm a Christian, and I believe in, I could play Christian music. Usually I'm very laid back and very playful and all of those things. I know it doesn't really come across in my videos, but I'm a very, very playful person. Maybe if I'm doing a vlog or something else, or if you go to my TikTok, then you can see my playful side. On YouTube, I'm always so serious and just giving the instructions, but yeah, I'm a very playful person. It doesn't come across. So I want to laugh. I want something to make me laugh. I want to play. I want to, you know, just, yeah, that is it. Yeah, go to my TikTok channel and you see my playful side. I am very playful. What can you bring to the trust, and why should we hire you? So it could be the trust, it could be a care home, so it could be tell them, what can you bring? You are the table. Have you seen that? Say, what do you bring to the table? The table? I am the table. Come on. So okay, seriously, you're this interview, what can you bring? You bring professionalism, you bring authenticity, you bring holistic care, and you're at advantage because you've seen care outside of the UK. So you've seen care in tropical, if you're from the tropics. So you've seen a different kind of care there. You know how you manage, and you've been able to care for people with minimal equipment, with minimal medication, with minimal whatever. So I mean, so which means you can work under pressure here. We are bringing someone that has tenacity, that is willful. You know, that is the kind of person that you're getting. So I mean, it's opportunity to sell yourself again, to sell yourself. And if you hire me, you'll be hiring somebody that is enduring, you'll be hiring quality, you'll be hiring, and you expatiate on that. So you can give an example, you know, of these are just some of the questions that I've listed. They might ask you that you should give an example of, as in case I don't know if they would ask you if you're coming from overseas, if they ask you a question on safeguarding, because I know particularly in Nigeria there's really no safeguarding the way we safeguard here. No offense, I hope this is not libelous, but it's true, there's no safeguarding the way there is safeguarding here. So if they ask, if they ask you a question on safeguarding, it might throw you. But the thing is, safeguarding is when you see somebody that you go to your patients, you see scratch marks on them, you see them being punched or sexual abuse. What do? Do you say, let's not say, oh, because you know we don't want to put this person in trouble, all of that? No, you have to report it. You have to report it to the appropriate authority here. I don't know about your country, if Ghana, Cameroon, or whichever, what safeguarding there, but yeah. So they might ask you a question like that. They might ask you a question, yeah, we've discussed that. So those are just quick tips. If you want more detailed answers to all of these questions, comment below and I will do it. But this is just something quick. All right, thank you for watching. God bless you. Hope to see you again soon. Bye-bye. Oh, please, don't, before you go, press the subscribe button. Click it and click the bell so that each time I post, you're going to get notification. So just do that quickly. Thank you. God bless you.